Hello friends, I'm Dr. Nikita. Today I'm going to talk about polyposis. It's a very common condition. Ethmoid polyps especially are very common and it's also a recurrent problem. Now there are the multiple factors which are responsible for formation of polyps. One is simple allergic rhinitis. Now what is the problematic factor in ethmoid polyps is that even if we are going to treat it with the help of a surgical intervention, they have a tendency to recur. So recurrence is almost like a rule. That is the reason why we try and medically treat it as far as possible. But if it is impossible for the patient to breathe, there is sleep apnea, and if there is a suspected allergic fungal rhinosinusitis component, then we go ahead and operate. This surgery can be done by conventional technique or with the help of the microdebrider. Once the surgery is done, it is important for the patient to understand that multiple follow-ups are extremely important. These follow-ups depend upon how aggressive the disease is. In the initial month, we go for at least 1 weekly follow-up, later on every 2 weekly, and then every 2 months. So patients with ethmoid polyps have to understand that they cannot do the surgery and just disappear. They have to be in contact with the ENT surgeon who has operated them. And as far as allergic fungal rhinosinusitis is concerned, it is very important for every ENT surgeon to send the polyp material for histopathology, because we have seen multiple cases in which inverted papilloma or sometimes even sinonasal malignancies have been diagnosed. Sometimes atypical presentation of mucormycosis also happens in this way. So the management completely depends on the histopathology. So any mass that is removed from the nose, whether it is bilateral polyps or unilateral polyp, has definitely to go for histopathology. This is about bilateral polyps. In unilateral polyps, that is antrochoanal polyps, surgery is the only option, and the surgery has to be done properly. The base of the antrochoanal polyp has to be removed, otherwise it has a tendency to recur. Otherwise antrochoanal polyps per se do not recur, and the polypoid mass should always be sent for histopathology. Inverted papillomas are also a common differential diagnosis for unilateral polyps. Apart from that, JNA, that is nasopharyngeal angiofibroma, also forms a differential for this. But the only difference in JNA, that is angiofibroma, is that it's a young patient usually and there are bleeding episodes. So if this kind of problem is there, then it's always better to have a contrast or an MRI scan in order to rule out that component. And what is most important is that never do a biopsy on the OPD basis for polyp patient, because we never know when it could be an angiofibroma and there will be torrential bleeding if somebody accidentally tries to take a biopsy for a nasopharyngeal angiofibroma. We have seen in tertiary centers similar cases who have been admitted and packed inside the nasal cavity because of this. So this is the information that I wanted to give regarding nasal obstruction and polyps, which we see in our common ENT practice. Thank you. I'm Dr. Nikita. I'm an ENT surgeon in pediatric ENT working at KIMS Kondapur, and have my setup in Bandikonda as well at Marichattu Circle. Thank you.